Hello, hello, everyone. Welcome to another episode of Protecting the Vision, sponsored by the National Optometric Foundation. And we are so excited to do this webinar with you today. We're going to have a great guest speaker with us that I'll introduce to the show later. My name is Dr. Timothy Brown. I am a board member for the National Optometric Foundation. We are, as an organization, the financial arm for the National Optometric Association. We support the NOA in various ways, as well as the NOSA, the National Optometric Student Association. We try to be there to do eye exams, especially during the time when we're having our NOA convention, wherever it may be. We serve where we go, serve in the community with free eye exams, partnering with VSP, also to provide glasses for those who are in need of glasses when we do their eye exams there. They get their glasses that same day, or they'll get their glasses mailed to them later. We also partner with various sponsors to try to support students who are currently in optometry school, those who are thinking about going to optometry school to become an optometrist. We also try to support our students who are in high school, and also just to give them some direction for a career pathway. We try to help highlight the three silent killers of the vision, which is glaucoma, hypertensive retinopathy, and diabetic retinopathy. We also try to make sure that we're there to educate the community, support the community and our community leaders in various ways when opportunity allows us to do so. We're going to continue to do these educational webinars to make sure that we are providing educational information for communities across the globe with our dynamic guest speakers who are volunteering their time and their wisdom to help keep the public informed when it comes to their vision, eye health, and other health-related conditions. Today, I have the honor of introducing to you Dr. Jason Blow. Dr. Jason Blow is a dynamic young man, and he has been involved with the community in various ways there. He has over 25 years of eye care experience and is the founder and owner of Now I See Family Eye Care, which he opened in 2007 in Lawrenceville, Georgia. He was born and raised in Natchez, Mississippi. Dr. Blow attended Alcorn State University and received a Bachelor of Science degree in Biological Sciences from the University of Southern Mississippi. Dr. Blow earned his Doctor of Optometry degree from the prestigious Illinois College of Optometry, where he was recognized with several honors. At his practice, Dr. Blow treats and manages eye diseases such as glaucoma, diabetic retinopathy. He sees patients for routine vision care and specializes in specialty contact lenses to treat eye conditions such as myopia and keratoconus. Dr. Blow is a clinical preceptor for student doctors through Pennsylvania College of Optometry at Salus University. Yay, PCO. And he's an active member of the optometric community. Dr. Blow is the past president of the Georgia chapter of the National Optometric Association and a member of both the American Optometric Association and Georgia Optometric Association. Dr. Blow is a life member of Alpha Phi Alpha Fraternity Incorporated. He currently resides in Gwinnett County, Georgia, with his wife, April, and their two children. And in his free time, Dr. Blow enjoys cooking. All right, Dr. Blow, listening to good music and spending time outdoors. And it's a pleasure to have him on this webinar with us. Dr. Blow, we are so happy to have you as one of our guest speakers here on the National Optometric Foundation webinar. Thank you so much for sharing your time with us and the wisdom that you're going to bring to our listening audience tonight.
Thank you, and thank you for the opportunity as well to speak to the masses.
Absolutely, sir. I'll be right back with you in just a moment as we talk about keratoconus with you tonight, what it is, what it's all about, and who should be concerned when it comes to keratoconus. And I just want to let you guys know the National Optometric Foundation, we have a website. If you want to connect with us, learn more about us, see our board members, you can go to our website, www.nationaloptometricfoundation.com. You can also follow us on Facebook. We have a Facebook page, National Optometric Foundation. We have a YouTube channel as well. These great webinars are going to be on our YouTube channel, National Optometric Foundation, and you can look at our past webinars. And if you would like to help us continue to do the great things that we do for the community, you can donate tonight. We have a Cash App. Nothing is too small. Try us and see. We'll accept all amounts. $ protecting the vision. If you would like to donate and help us to continue to do the great things that we're doing. Thank you so much for being here on this webinar. Please share it with your family and friends so that they can be informed as well. Let's go ahead and get started, Dr. Blow. Again, I'm thanking you for your time and for sharing this topic with us, all about keratoconus, what it is, who should be concerned, and our listening audience. If you have any questions for myself or for Dr. Blow, please put it in the comment section, whether you're on Facebook or if you're on YouTube, and we'll do our very best to try to answer as many questions as we can tonight. Dr. Blow, so you are here, you're working. That's one of your specialties here with keratoconus that you see. And a lot of people do not know what keratoconus is. You see this in your practice there, and I want you to just try to give us some insight as to what keratoconus is, and then we'll go from there.
Okay. So, keratoconus is a condition where the cornea, which is the clear window in the front part of the eye, it becomes weak and thin. And eventually the cornea starts to bulge out like a cone, hence the word keratoconus. So it is a sight-threatening disease, but it can be treated and managed.
And the people that come to you and you find out, or you later on diagnose that they have keratoconus, someone may be wondering, are there any early signs or are there any symptoms that may indicate, that they could have possible keratoconus, and maybe they need to go in to see an optometrist about this?
Sure. So some of the symptoms include uh, double vision, especially if you're covering one eye and you still have double vision. That's one symptom. Another symptom would be blurry vision, whether you're looking at things far away or up close. Sensitivity to light is another symptom. Glare, especially at nighttime. Difficulty driving at nighttime is a symptom as well. Uh, Halos and seeing streaks around lights could be a symptom also. Seeing ghost images. So, for example, you may look at a stop sign and you see the letters STOP, but in addition to that, you see a letter S and then another S right beside it, like a ghost of it. You see the letter T and then another T. So that's a symptom as well. Another symptom also is that if you find yourself having to change your prescription for your glasses frequently, then that could be a sign as well. So
Okay.
all of those things can be symptoms and signs. It's best to come in for an exam. We can diagnose keratoconus in the office by doing some tests. There's one test called topography, which is essentially a map of the eye. It shows us all the peaks and valleys of the cornea, so we can diagnose it with and confirm it with topography.
Wow, that's great. And that's good that you have that at your practice there, so that these things can signal to you that someone could have this condition, and you guys can um, give them the direction that they need as far as managing it and everything of that sort. So those of you who are listening, we don't want you all to run into your optometrist office and say, I have keratoconus, but we do want you to be aware of some of the symptoms of keratoconus. As he was saying, the increased sensitivity to light. There's a possibility of increased double vision that you may start having symptoms of, glare, ghost images that he was talking about, and also he's talking about halos as well. All of those things could be indicators for possible keratoconus there. And so someone may be wondering, and then it's good too, he mentioned that your doctor could have an equipment in his office topographer to also map out the front part of the eye, the cornea as well. But what actually caused keratoconus to happen to so many people? And do you see this with children and adults? Black, white? Is there a particular race or gender? Uh, can you give us some insight about that?
Yes. So we really don't know exactly what causes keratoconus, but there is known to be, or is believed to be, a predisposition at birth, actually. So you may actually be predisposed to it as soon as you're born. So essentially, what happens in the cornea, once again, that's the clear window in the front of the eye. We have this protein called collagen. We have these collagen fibers in the cornea, and they eventually become weak. They or may even lose some of those collagen fibers, and that what actually causes the cornea to start to take this cone-like shape. Uh, it is more common in men versus women. Um, there are about 50%, people who are black or Latino are 50% more likely to get keratoconus compared to our white counterparts. Uh, so there's also some things that can contribute to keratoconus as well. So although we don't know what causes it, we do know that there are some risk factors as well, such as rubbing your eyes.
Mm,
Excessive rubbing of the eyes can contribute to it. Uh, Doing what we call face planting, which is, and a lot of people say, well, what's face planting? Well, that's almost basically sleeping on your stomach and sleeping on your face, putting your face in the pillow while you're sleeping. That can contribute to keratoconus as well. Having a family history of keratoconus. So there's every 1 out of 10 people that have keratoconus usually will have a parent or both parents with keratoconus as well. Different inflammatory conditions such as asthma, hay fever, allergies can contribute as well. There's also other systemic conditions like Down syndrome, osteogenesis perfecta. I know that's a big word, but there's a condition that some people may have, and there's a link there as well. There's also an eye disease called retinitis pigmentosa, which is
mm.
also a genetic condition that shows some link to keratoconus also.
Well, I guess you answered my question. I was going to ask, should I be concerned? If my parents and I, I'm speaking as if someone was listening, was speaking. If we're talking to our parents or we're talking to our sister or brother, and we find out that there's a family history, should I be concerned? Should I be concerned that my genes, may pass this on to my children, or maybe I could be affected with this? Just is the condition hereditary is what I was going to ask, but it seems like you answered my question there. Any more details on that?
There is a genetic link, um, and you're more likely to get keratoconus if a family member has keratoconus. So yes,
Mm.
that's correct.
Yeah, so we encourage you all to talk to your family when it comes to your health history. I know sometimes families don't always sit around the fire talking about medical talk and history and everything, but it's important so that these things can be shared with primary care doctors, with optometrists who are the gatekeeper of the healthcare system as well, and for better care for you and your family as well there
Right.
too.
And the
Yep.
condition, yes, it is a somewhat rare condition, but we're finding that there's keratoconus that's been undiagnosed. Some studies even show that 1 out of every 500 individuals have keratoconus. Some people may ask, okay, I think as you asked earlier, are we seeing this in children? Well, yes, sometimes you can see it in children as young as 10 years old. Uh,
Wow.
Typically, it starts around the age of puberty and can progress all the way up until the mid 30s. So
Mid
there's a big
30s.
range of where it can start.
And like other eye conditions and eye diseases, is it safe to say early detection is good?
That is correct. The earlier it can be detected, uh, the better the outcome of treatment. Uh,
There you go.
there, there is genetic testing available as well that will give us gene markers and are predictive. Uh, so there are tests that can be done.
There you go. Once again, we are talking about a topic where we are telling you early detection is important. So that means don't delay, do it today. Get your eye exam scheduled with your local optometrist. Those of you who are listening, don't delay, do it today. Get your eye exam scheduled with your local optometrist so that we can rule out and we can also assure and we can also protect your vision, making sure that you don't have any health conditions or vision conditions or disorders that can be detected early and managed with your local optometrist. Okay, I just like to put that out there, Doc, because a lot of people we meet here in office, they haven't had an eye exam in 10 years, some
Yes,
more. Some they come in, we see them at the age of 30, 35, 40, and they feel bad, but I tell them, don't feel bad. They say, hey, this is my first eye exam. I said, look, we're glad that you're in the building because
that's
it's
right.
best that you be here now and versus you never coming and there's something that goes undetected, So and things have been detected because they come in for their eye exam. We just want to make sure that everyone we can preserve vision, protect the vision as long as we can, guys. So that's why we do these webinars. This is why we, as optometrists, try to educate our patients. And when we see one member from the family, we encourage the mom or the dad to bring in the rest of the family if possible there. And we see that a lot here. We see a lot of children. And usually when you take care of the children, mom want to come. And then if we get mom coming, mom eventually she's dragging dad into the door, So it's just beautiful. And I know you probably see that at your practice as well. Taking care of the entire family is the desire. We want to be able to see everyone, take care of you, young and old. We see children age 6 months on up, So getting that exam early is important. So once again, get your eye exam scheduled with your local optometrist so that we can see you not only just because you need glasses or you may need contacts, but also to check the health of your eyes as well. Just want to put that plug out there for you guys. So this condition, keratoconus, how common is it, and who's at risk for keratoconus? If you can enlighten us, please.
So there's there's various studies out there, and as I kind of mentioned before, some studies show that 1 out of every 500 people have keratoconus, but I think the average will be approximately 1 out of every 2,000 people uh, will get this condition. It can start again once again around the age of 10, as early as 10 years old. They'll start to see signs and symptoms, uh, and but for a lot of people, it is diagnosed in the late teens. But it can be detected as late as the 30s as well. People who are at risk are some of those folks I was mentioning before, which would be people who are predisposed from birth. But also adding to it, people who rub their eyes. There's also uh, other conditions as well. I mentioned Down syndrome earlier. There's another condition called Ehlers-Danlos syndrome. Uh, those folks are at risk. So essentially, we want to be preventative, as you mentioned, by getting regularly scheduled eye exams, because sometimes we don't know we have this condition until it's into its advanced stages. So we would definitely like to catch this earlier than later.
Right.
That's
And
good.
and I was going to ask you, sorry about that. I was going to ask you too, Doc. give us like a walkthrough, at your practice there, how it goes, when first, I guess, the detection, um, and then what's the steps after that as far as managing keratoconus, what's involved there with that as well.
Okay. So sometimes a person will come in and just say, "Hey, I can't see." They may have come from another practice, another office, and say, "Hey, they've never gotten these glasses right. I had these glasses done 2 or 3 times, and I still can't see." Well, that's a
Right.
red flag. Let's find out why. There's a reason why you cannot see through your glasses. And so, if we cannot correct a patient up to what, we all hear of 20/20 vision, right?
Right.
So 20/20 vision is normal, but if we cannot get your vision to 20/20, then we need to figure out why you cannot get to 20/20 vision. So if we do all our testing in the regular exam and we're seeing a high amount of astigmatism, for example, that is a red flag for the practitioner, for myself. And so I may say, okay, hey, let's run a test because I tell the patient I am suspicious that you may have a condition called keratoconus. And this may be the first time they're hearing of it. And I explain to them, okay, this is when the cornea starts to poke out like a cone. And we have a test here that will map out the cornea to show us if there truly is a steepening of the cornea. From there, if we do see that it is in fact keratoconus, then there's a couple of different treatment options. Sometimes it is simply glasses. Sometimes glasses can correct keratoconus in its mild stages. Soft contact lenses uh, can can correct the vision. It does not treat the disease. It does not reverse the disease, but it allows the person to be able to see well.
I see.
Uh, if glasses and contact lenses don't work, then or just your standard soft contact lenses don't work, then we start looking at what we call gas permeable contact lenses, hard lenses. So the hard lenses not only will correct the vision, but it also somewhat keeps the cornea in check. It somewhat prevents the cornea from continuing to poke out and bulge out like this cone. Some people cannot tolerate hard contact lenses, so sometimes we have to do what we call piggyback contact lenses. So that's where you have a soft contact lens on the eye, but then you place a hard contact lens on top of that lens. And once again, the purpose of that soft lens being under the hard lens is just more so for comfort, but the hard lens is actually what's giving the patient clear vision. We also have what we call hybrid contact lenses. So this is a contact lens where it is hard in the middle, but there's a skirt. Think of a donut almost. The whole of the donut is the hard part of the lens, and then the dough of the donut is the soft part. It's a skirt, and that's also done to aid in comfort. Another option is to go with what we call scleral contact lenses. A scleral contact lens does not touch the cornea at all. It actually touches the white part of the eye. That's the white part of the eye is called the sclera, and so these lenses will rest on the sclera and vault over the cornea. And this is usually a very comfortable option for a patient, and they can see very well through the scleral lenses.
Wow. Wow, Doc. I guarantee you there's a lot of people listening. They did not know that those options were available for keratoconus. Even talking about the soft contact lenses, similar to ones behind me, possibly being able to help someone who has the mild stages of keratoconus, uh, even that, may be surprising to some people there. So all of you who have questions or any fear, you maybe heard that this was in your family and you haven't gotten checked, by your optometrist, but you're having some of these symptoms that we mentioned earlier in the webinar. Go get checked. There are options. You should want to, know your options there. As Doc laid out, the options are there to give you comfort and clear vision. And those lenses are designed to do those things there. He's mentioned the piggyback opportunity. If glasses and soft contacts are not working, he talked about a hybrid. opportunity, and he also talked about the scleral lenses as well as an opportunity to help correct your vision so that you can see better. Uh, and that's what we want to do. We want to help you see clearly, and we want you to be comfortable as well. So that's a really good rundown as far as when a patient who has keratoconus comes into your office. That's really good. Now, some may be wondering, is there anything that they can do to increase, chances of getting keratoconus, or is there something they can do to minimize, decrease the chances of getting keratoconus? Is that out there? Is there any possibility?
So unfortunately, there's not anything you can do to avoid getting keratoconus because once again, you're kind of predisposed at birth. But there are some things that you can do to aid in treatment. So as you mentioned earlier, early detection is key. Having annual eye exams will aid in diagnosing the condition early. Try not to rub your eyes, especially you sometimes see the kids they're rubbing their eyes, they're digging in. Try to avoid rubbing the eyes. Try to avoid sleeping on your stomach, sleeping on your with your face in the pillow. Those are things that you can do to help prevent progression of keratoconus.
So grandma wasn't wrong when she saw you rubbing your eyes, and she'll tell you to stop rubbing your eyes. And they come and sometimes they'll have to come and move your hand because you get in there and it start feeling so good, and you just keep rubbing. And and then people doing that so many times, throughout the day. We learning now that could cause you to be at risk of this condition, keratoconus.
That is
Wow,
correct.
wow,
Grandma
learning a
was
lot
correct.
tonight. Learning a lot tonight. So grandma was right. Grandma and mom and dad and auntie, when they're telling you not to rub your eyes so much there because it can cause problems for you in the long run. Okay, very good. And so with keratoconus, there's been talk about surgery. Those options there. Um, can you enlighten us a little bit about surgery and then also, are there ways to improve vision without surgery?
Okay. So I'll take the last question first. So the ways
Okay.
to improve vision without surgery will be the options that I just mentioned before, which would be the various forms of contact lenses as well as glasses. Typically, that's going to help in mild cases of keratoconus. Usually, it does not help in moderate to severe cases. So, surgical options usually it involves a collaboration between the optometrist and the corneal surgeon. So, one procedure that is very common right now is called corneal cross linking. So earlier I mentioned that there's a protein in the cornea called collagen. They're fibers. And so basically with cross-linking, collagen cross-linking, riboflavin eye drops and UV light will help strengthen the collagen in the cornea. This will not reverse the keratoconus, but it will prevent the keratoconus from getting worse. It will stop the bulging. It will somewhat flatten the cornea and it allows a person to be able to say, okay, hey, I can be stable with this condition after I have the cross linking done. Now, typically, after the cross linking is done by the corneal specialist will send that patient back to me, and that's when we start looking at doing scleral contact lenses, for example, because now the patient has uh, a better looking cornea, and so the soft lenses may work a little bit better after the cross linking. But typically, we're looking at doing scleral lenses or one of the hard lens options to correct the vision. Uh, there's also other types of procedures as well that involve what we call implants, so ring implants. So these literally look like a semicircle, and it's a synthetic material, usually surgical grade acrylic. And there's different types. There's some that are available in the United States, some that are not available in the United States. But it's the same concept of putting these rings uh, implanted into the cornea. And the idea behind putting these rings in the cornea is to flatten the cornea, once again, to have a better looking cornea. Maybe we can now do contact lenses to improve the vision, but also to prevent the progression of keratoconus. So some of those procedures, there's different. They go by different names. Once again, there's some that are available in the United States, some that are available in South America, European countries as well. Uh, One of the more common ones here in the United States is called intrastromal corneal ring segments. Um, we call that ICRS. We abbreviate that ICRS. And another is called INTAX. Those are two very common ones that are available in the United States. Uh, Other surgical options are a little bit more invasive. Uh, there's one that's called deep anterior lamellar keratoplasty. That is where the front part of the cornea is removed, but the inner surface of the cornea is left intact. And so a donor tissue is placed in on the cornea, and essentially you have a new cornea, for lack of better words. Um, there's pros and cons to it. You know, one of the pros is that graft rejection is eliminated because you still have your stem cells, your cornea, the inner surface of your cornea is still left in place. And then also you have faster rehabilitation results as well. So you can get back to seeing better quicker with that procedure. Now, the con on that is that that procedure for the surgeon is technically a little bit more difficult because you're leaving a part of the cornea in place, and but you're replacing the other part with donor tissue. Another common procedure, and probably I would say is the standard uh, care, is what we call just essentially your penetrating keratoplasty, which is a full corneal transplant. And with that procedure, um, donor tissue is placed into the eye. So a basically a little button. If you think of a little circle cut into the cornea, that tissue is removed, and then donor tissue is placed in the cornea. Now that has a long track record, has a high success rate, but once again, one of the cons would be graft rejection, meaning that your tissue does not mesh with the donor tissue, and then it does not work, and then we have to try to find a, some different donor tissue. So you have a couple of surgical options. Once again, after those surgical options, typically the corneal specialist will send that patient back to me to improve the vision by way of most of the time contact lenses.
Wow.
Hopefully that wasn't too much.
Wow. Wow. I mean, you went in depth greatly about these options that people have when it comes to treatment and it comes to management. One of the things you did mention where you're talking about the cross linking, it makes sense. You're strengthening the collagen because you mentioned earlier in the webinar at the beginning that one of the reasons why keratoconus may happen is because the collagen is weak, and everything. So it makes sense to do that, to go in there and strengthen the collagen there. And, I was going to ask you about the risk of rejection, but you also highlighted that there's a possibility that, the donor's tissue may be rejected. How much of a window will the corneal specialist have for finding another match? How does that person, they go back home that day, or do they stay, in care of the specialist there or anything? Do you have any insight about that part?
So typically, you don't know if it's going to be if you're going to have rejection on the first day. It's usually after the surgery has been performed and the eye starts to heal, where we will find that uh, there's graft rejection. So typically, this is a period of about 3 months to 6 months, sometimes even up to a year, where the uh, the graft not uh, may not be acceptable. It may reject.
Okay. So those options are there. Are there any other treatment options that you would like to share that maybe you haven't already covered, or those are the main ones that, when it comes to keratoconus, those are the options that we have for?
Those those are your main options that we have right now. Uh, Visually, with the glasses, soft contact lenses, hard contact lenses, hybrid sclerals, and with the surgical procedures, you're looking at the cross linking, which is very common now, the ring implants, and then I would call the one of the procedures that I mentioned before a partial corneal transplant, and then also your full corneal transplant. Those are your options.
So the partial is where you say you would take off the front layers of the cornea, but leave uh, the back layers on there. So you put the donors, partially on there and have the other one intact.
That is correct.
Yeah. You feel with the recipient having partial intact there, is there a higher chance of, not having that rejection? Does that rejection still, do you see where the cases are still high for rejection, or does
So
that
reject.
minimize the rejection?
So yes. So with the partial, rejection is kept to a minimum, but
Okay,
you have to have a very skilled surgeon to be able to
to do it.
tease out the correct portion of the cornea without uh, having a ruptured eye. So sometimes if uh, you're doing this procedure, your intent is to leave the cornea, at least the inner layers, intact. But sometimes mistakes happen. There are
Mhm.
risks with surgery, and the globe, which is the eyeball itself, can be penetrated. And now we are in a
Yeah,
big problem. We have a big problem now.
yeah.
So, so you would definitely want to make sure that the surgeon that does that procedure has done that procedure, has a good number of those procedures under his or her belt, and but it is a good procedure because now you really don't have the risk of the rejection, the graft rejection.
So you're telling our listening audience to do their homework, right? When you're going in for any type of procedure or surgery, you should, do some background work, to find out, or ask the surgeon, about their track record, and everything of that sort
That's
uh,
correct.
before going
You
to the
want
procedure. Now, tell
definitely
us a
want
little bit as we come near the end of this webinar, maybe. How does it work when you fit someone with the scleral lenses or whatever? How does it work as far as follow up care with you? Can you give us some insight about that?
So yeah, so typically with a scleral lens, the initial process takes can take up to 2 hours. It's a very time. Um, it takes a lot of time to do this procedure or this fitting. But once we get the right fit for this lens, uh, people love the vision that they have. So typically, follow up with this with a scleral lens would involve coming in regularly. Typically, we will see the patient after they have their initial lens. That we will see them back in a week just to make sure vision is good, make sure that the cornea is not being compromised. We will see them back in a month, and then typically 3 months after the initial dispensing of that lens. Uh, there, although it is a contact lens, it is a special lens, and we have to make sure that the cornea is not being we're not getting swelling of the cornea. We're making sure that we're not getting a lot of debris in this lens, and we want to just make sure the overall health of the eye is still intact with a scleral. So this process with a scleral lens, the follow-ups are you have more follow-ups with this lens versus a say for example your run-of-the-mill soft lens.
Right,
Your
right.
vision is
Because
tested
um,
frequently.
right, right. And and speaking of time consuming, I was just wondering, and maybe other optometrists who are listening, maybe wondering, do you fit these type of exams or fittings in with regular eye exams, or do you have a special day where You may call it Keratoconus Day, where you guys already just schedule your keratoconus patient so you can have that window of time.
Well, we typically will schedule a window of time for the keratoconus patients. Um, because it takes time, yes, we have to block off, time because we want to give the attention to the patient
Right.
and make sure that we're not, thinking about the next patient that's on the schedule,
Right.
right? So we do have time set aside for patients with specialty lenses like this.
That's good. And I assume that's with all specialties, even here with vision therapy, there are certain times of the day where vision therapy evaluations are done and then vision therapy sessions are done as well. So just want to make sure that that's about the same with your specialty there as well, because um, it takes that time for the extra care, and um, not everybody is specialized in handling keratoconus cases there. So people may want to come see you, and I'll give you the opportunity to be able to share that information with our listening audience as well. They want to go see, Dr. Blow, where they can find you at, and follow you on social media and things of that sort as well. But before we get to that point, I just wanted to see if there's anything additional that you would like to put out to our listening audience when it comes to eye health, keratoconus, whatever it may be. This is the opportunity where you can also share that information as well. Maybe something that we could have talked about, and you said, "Hey, I want to make sure that I share this last point as well." There.
Okay, so yeah, sure. Uh, Really, early detection. Be your own advocate. Ask questions when you go to your eye doctor. Uh, if the has one foot out the door and leaving, and you haven't answered, the doctor hasn't answered your questions, then you want to make sure you ask questions. Say, hey, I have a question about this. I'm concerned about this. So definitely be your own advocate and ask questions. Um, there Early detection, once again, there are some other I think we talked about, genetics and being hereditary. There are some options for genetic testing as well. uh, there's a test that's called avagen, and it is a swab that you just do in the office. You take a
Oh,
swab and swab the mouth, and the sample is sent off for gene sequencing, and it gives you a risk factor. So if you are a person with keratoconus and you're concerned about your children getting keratoconus, then this swab can be done to give us a predictive factor. That particular test right now is not covered by insurance, and it runs about $300. Um, but it may be worth it if you are concerned. Most of the procedures that we talked about surgically typically are covered by insurance when it is proven that some of the other options do not work. For example, if we've proven that the keratoconus is progressing even with a hard lens or a hybrid lens, then insurance will pay for the surgical procedures. Insurance will typically cover the scleral contact lenses as well, or the
mm,
hard lenses. This is what we call medically necessary contacts. So this is not your regular run-of-the-mill soft lenses, but medically necessary contact lenses usually are covered by vision plans as well as some medical insurances as well.
so
I
you,
would say make sure that you, wherever you are, check with your local optometrist. If you want to know more information, you can Google keratoconus groups and things of that nature. There's one that's called keratoconusgroup.org, which will give you some insight as well. There's also support groups as well. If you are diagnosed with this condition, support groups where people just kind of share their experiences and what works for them and what hasn't worked for them as well.
and that's good. And I was going to ask you about that. Like, wow, insurance will cover, the treatment and also cover the contacts as well. But medically necessary, yes, they will. Some insurances will do that coverage there for them. And that's good. That's good that patients have that coverage there if the condition arises, and they have keratoconus. That's good to know. Uh, One of the things that I wanted to highlight also is how easy for people to, get tested. The genetic testing that you mentioned in office there with a swab there. So that's good to know as well for those who are listening to the call. And then one of the most important things that we try to tell patients, ask questions. When you come to see your doctor, even your primary care doctor, your optometrist, be sure that you're not afraid to ask questions. We actually appreciate when you ask questions there. And you can even come in with your questions already written down so that we can get right to the point and try to help answer those questions as we're going along with your eye exam as well there too. So thank you,
Right.
Doc, for reminding the public that they should always be prepared to ask questions. We want this to be a back and forth conversation when you go to see your primary care doctor, you go to see your optometrist. We don't want it to be a one-way conversation where the doctor is doing all the talking and then you just start walking. We want you to start talking back to your doctor. Be comfortable, build that relationship, and open up that communication door with your healthcare providers. We know that's important. And me as a patient with my primary care doctor, that's one thing that I can say that I appreciate is the fact that he's never rushed. He's always sitting and listening and asking questions and allowing me to ask questions because he's there to help, with my health. So we want you all to know we're here to help protect the vision. We want you to see well. We want you to have a healthy life of seeing clearly and enjoying all the beautiful things around us. So we want to make sure you don't delay. Schedule your eye exam with your local optometrist. This is your wake up call. Some of you have been putting it off. You've been delaying it for your children. And today I am encouraging you under the sound of my weak voice to get your eyes examined so that we can help protect the vision. We had Dr. Jason Blow with us as our dynamic speaker, telling us all about keratoconus. He went in depth. He gave some examples of treatment options. So he gave examples of fit options as well when it comes to contact. He did a phenomenal job, and we applaud you, Dr. Blow, for sharing your wisdom with us there. And we hope that um, patients that you have taken care of may hear this webinar and get some insight if they haven't had that conversation with you. But also, people who are listening to this and perhaps they want to come and see you and allow you to take care of their eyes as well. How can they find you? How can they follow you? And you can give us any closing thoughts and words of inspiration that you may have for our listening audience today.
Oh yeah, sure. So I encourage wherever you are, see your local eye doctor, your local optometrist. But if you are in Metro Atlanta, the name of my practice is Now I See Family Eye Care, and that is the word I, EYE. Now I See Family Eye Care. We are in Lawrenceville, Georgia, 3153 Sugarloaf Parkway. We're in Suite 201. Our phone number is 770 682 6525. You also can find us on Facebook, Now I See Family Eye Care, and also Instagram, Now I See Family Eye Care. I will say make sure once again that you have an annual exam. And in general, if you have a eye problem, see your eye doctor. A lot of us
Mhm.
find that we go to urgent care and the emergency room and things of that nature, but if you have an eye problem, see your eye doctor.
I love that. I love that. And I put the spelling of his practice in the comment section on our YouTube channel, National Optometric Foundation. So you can go to our YouTube channel for this webinar and look in the comment section and you can find that. Doc, before you leave us, there is a question about wondering which of these procedures or management strategies are covered by insurance. If that's the question there, if you understand that question there.
Okay. So yeah, with procedures, as far as the surgeries are concerned, uh, cross-linking. There's two types of cross-linking. So you may hear these words with epi on and epi off cross-linking, and you can talk with the surgeon a little bit more about this. But the epi off cross-linking is covered by insurance. Epi on is not. There are ways that, and basically, essentially, what this means is that the top layer of the cornea with epi off is removed, which allows the riboflavin to be penetrated into the eye a little bit more easily and cured with this UV light. Uh, Once again, if some of the um, other options, such as the soft lenses and hard lenses, have proven to not work, then typically all of the surgical procedures will be covered by insurance. The scleral lenses and your hard lenses, once again, if it proves that your vision can be improved with these lenses compared to glasses or soft lenses, once again, typically these lenses are going to be covered under what you call medically necessary contact lenses. So, yes, insurance will cover um, these procedures as well as some of the vision options. Once again, if it is proven that you have this condition and also if there's progression of the condition.
There we go. And if you would, thank you for answering that question for uh, Dr. Andre Whitehead. He posed that question on our YouTube there, and he also gives his thanks to you for answering that question. They're very good. You said that there was a website that they can go to. Is it Keratoconus Group?
Keratoconusgroup.org. That
Okay.
is one. And so that is a website where you can get some support. It's basically a support community. Um, and if you just simply just Google Keratoconus support group, um, then so there may be some options there. May even be local for you as well.
Okay, very good. That is also in the comment section for those of you who are listening live now on the webinar or maybe catching this webinar in the future. Their support group for those who have keratoconus there as well. All right, very good, Doc. So good. Thank you for sharing where if someone's local in the Atlanta area where they can come and see you and how they can follow you and be connected to you. We appreciate all the services that you have given over your course of years there. Hard to imagine that you've already done 25. You still look so young, but we'll take you at your word that you have 25 years there. That's fantastic service that you've given to so many people and to the community. And we want you to continue doing the great things that you're doing. And hopefully one day we may be able to have you back on our webinar in the future as well there too. But we thank you so much for your time and thank you for sharing the wisdom with our listening audience here on this episode of Protecting the Vision as we talk all about keratoconus. And we hope
Thank
that you
you.
will have a great day as well, Doc.
Thank you. And thank you for the opportunity.
Absolutely. So there you go. Great episode of Protecting the Vision. Dr. Jason Blow shared with us some insights about keratoconus. And we want to continue to do these webinars for you every third Monday at 7 p.m. The National Optometric Foundation is a nonprofit organization, and we accept donations of any amount. We have a Cash App, $ Protecting the Vision. If you would like to support us and allow us to continue to do the great things that we're doing for the community, as support of the students who are in optometry school, thinking about going to optometry school, please donate and allow us to continue to do these great things. We thank our great sponsors and those who have donated over the course of years to help the NOA and the NOF to continue to do these great things. And we also have a website, www.nationaloptometricfoundation.com. You can go and learn more about the organization, the foundation, our board members, and the great things. We also have photos on our website as well. We have a Facebook page. You can like our Facebook page. We'll keep you updated on things that's going on in the NOA and the NOF, and we have that on the National Optometric Foundation. And of course, our YouTube channel that I mentioned earlier is available for you to see webinars from the past that our great speakers have shared words of wisdom as we continue to educate the communities. We'll continue to highlight the 3 silent killers of vision: glaucoma, diabetic retinopathy, hypertensive retinopathy. We'll continue to support the NOA and supporting students as best as we can and as much as we can. Our generous sponsors such as Johnson & Johnson, VSP, Essilor, Hoya, Alcon, Walmart, National Vision, Cooper Vision, B&L, Modern Optical, Versant, Luxottica, Dompe. Thank you all, and thank you individuals who have also donated towards the cause. We look forward to seeing you guys on our next webinar coming up in October. We look forward to sharing with you as we wrap up the 2024 year on our next webinar. Thank you for tuning in, and I'll see you on the next webinar.